I want everyone to know who's listening that as far as healthcare is concerned, the fix is in. We are not in a system that is looking out for the patient, that is concerned about healthcare advancement and technologies and how they can improve quality of life. That is not the number one goal of our system as it stands right now. The number one goal of our system is to essentially lace the pockets of the payers. The middleman is the one that is in control.
Welcome to UpMed, a journal of healthcare's race to the bottom, hosted by Dr. Rowe Urquhart. Join Dr. Erica and her guests as they pull back the curtain and share a behind-the-scenes look at the healthcare industry, all while providing solutions for better patient care and management. Now, here's your host, Dr. Erica.
Hello, and welcome to the first episode of our podcast, UpMed, the Journal of Healthcare's Race to the Bottom. I'm your host, Dr. Rowe Urquhart. My background is orthopedic surgery, and the reason that I started this podcast was because I wanted to share the stories and the insights about healthcare and what's happening right now in our society and environment. I want everyone to know who's listening that as far as healthcare is concerned, the fix is in. We are not in a system that is looking out for the patient, that is concerned about healthcare advancement and technologies and how they can improve quality of life. That is not the number one goal of our system as it stands right now. The number one goal of our system is to essentially lace the pockets of the payers. The middleman is the one that is in control. And I want everyone who's listening to understand that that's the premise of this podcast, the Journal of Healthcare's Race to the Bottom. So I jumped right in to the ending of the story, a dysfunctional healthcare system that is focused on shareholder value, not on the patient care, not on really helping people. But before we can really get there, and before I can get you on board with understanding that that is truly the case, I want to first talk a bit about what we as healthcare providers, as physicians and surgeons, are experiencing now and our journey to getting to this place. Because obviously, unless we're profiteers, unless we're actually the ones who are shareholders of United Healthcare, Cigna, Aetna, we're not the beneficiaries of the dysfunction that we're currently finding in the healthcare system scenario in the United States. Most of us do not come from wealth. Most physicians and surgeons, our background is being intellectually gifted and talented. And not only having those gifts and talents, but having a measure of discipline and accountability that would allow us to first get into colleges that would essentially give us the credibility to be accepted into medical school. It is not very easy, as anyone who's applied knows, to prepare oneself to go to medical school. So after graduation from high school, most of us then went directly to to high school, from high school to college, and then from college to medical school. And in order to get into medical school, most of us had to do very well in our college courses. We had to study the prerequisites for medical education, which would include biology, chemistry, calculus, physics. We would have to do well enough in those courses that the admissions committee on any medical school board would say this person can handle pathology, pathophysiology, and all of the different disciplines within medicine. After preparing ourselves both in the classroom and outside the classroom for potentially caring for patients, we would have to take an exam called the MCAT and get scored well enough on that exam to then consider ourselves competitive for medical education. We would have to apply a year in advance for medical education just to get a seat. And then once we got that opportunity, we had to go on interviews around the country until we could find a medical institution that would accept us. So, my personal background was I'm from the inner city in San Diego, California. I was fortunate enough to do really well in high school and matriculated at Harvard University, where I pursued a bachelor's of science in biomedical engineering. With the engineering degree, my thought process was if I don't get into medical school, I've got to get a job. And engineering is a good job. So engineering was my plan B. But as a result, I had almost no electives between the core curriculum, the med school prerequisites, and my engineering requisites because I did want to have an accredited engineering degree. I had no time. And I did, however, take what little time I had to pursue extracurricular activities that would give me exposure to the medical profession as well as provide cultural and emotional fulfillment. And after I did all of that, I then in my junior year found myself in a position where I was taking the MCATs. And after completing my third year in college, applying to medical schools, I had to choose summer positions that would allow me to earn enough income that I would be able to fly around the country to apply and interview to the top medical schools in the country. And I did end up getting into most of the medical schools I applied to. I chose not to stay at Harvard for financial reasons. So I chose a kinder, gentler financial aid package and a very strong medical institution, the Johns Hopkins School of Medicine. And at Johns Hopkins, I then found myself in a position where I could apply for federal funding to attend medical school and do graduate work. So I pursued the MD PhD program at Hopkins, all the while anticipating that I would be able to be in a position to not only exercise my intellectual chutzpah, but also help people. And what I mean by help people is to meet patients where they are, assess their condition, be able to make a diagnosis, come up with an intervention that would be appropriate for the pathology they were experiencing, and ultimately send them on their way healthy and well without that pathology bringing them down. So, I would like to reflect on the stories that you're going to hear in this podcast and say that my story is not unique. I have four wonderful guests in this season that will share with you their experiences as well, how they came to think about medicine as a career, what they feel medicine is now relative to what it was when they started. And by doing this, I want to give each listener a perspective on who we are as doctors. And if you are a doctor, you'll say, yes, that's me. You will feel affirmation in your experience as well as the decisions that you've made. I'd like to just reflect a bit on the transition of what it means to be a doctor from when I started in the early 2000s to where we are right now. At Johns Hopkins, they started this ceremony they call the white coat ceremony. And I believe Hopkins, as one of the first medical institutions, was actually one of the first institutions to start this. But it's essentially a ceremony where, as a medical student, when you enter, you are given your white coat and your stethoscope. And it is placed upon your back by either the dean of your medical school or a mentor in the academic administration who is essentially blessing you and saying, "Go ye forth and practice medicine." And I felt at that time just awe and amazement at both the honor and the responsibility of being designated as one qualified to wear the white coat. It was a moment where I had this clandestine sort of clashing of both my anticipation of what a career in medicine might be and the preparation, all of the years of sacrifice and determination that were required to actually be on that stage. And if we were to fast forward 15 years to my being in a private orthopedic surgery practice, my putting on the white coat meant something completely different. To be perfectly honest, there were days when I didn't want to put on the white coat, where I would rather wear scrubs or I would rather wear my suit and not have to take off the jacket and put on the white coat. Because once I put on the white coat, I'm accepting the burden and the responsibility of meeting the obligation that is associated with practicing medicine in a very toxic and hostile environment, as opposed to being one who is respected and revered for the years of education and the time that it took to become an expert in my field. I would feel once I put on that coat that I was subject to criticism, suspicion, fear, even, the white coat syndrome. Once I put on the white coat, then all of a sudden patients would experience fear and sympathetic discharge, resulting in increased blood pressure, increased heart rate, and anxiety. So the white coat went from being a symbol of sacrifice and an opportunity to be a benefactor to the improvement of society. It went from being that to being a source of fear, anxiety, and suspicion. Additionally, a weight that no individual would want to carry for a career of 40 to 50 years in an environment such as this one. So, I just wanted to share as we start that in this scenario where, as healthcare providers, we are experiencing challenges, not only challenges in the sphere of attempting to fight disease, being on the side of the patient against disease processes, but in the scenario where we're fighting payers. By payers, I mean PAYORS, insurance companies primarily, where they are counting every nickel and every dime and creating scenarios where they can get us, the healthcare providers, to take care of patients, and then they will pay us nothing, denying our claim, stating that we neglected either to get prior authorization or neglected to submit the claim on time when rarely, if ever, those claims are true. What I began to notice just a few years into practice was that there are algorithms out there where the insurance companies will essentially determine that they're only going to pay 60% of the claims that they receive the first time. They will require that we resubmit our claims for payment. And in what industry can one receive care or receive the service without paying for the service? If we go to Starbucks, we can't ask for our white chocolate mocha on credit or say, oh, you made it not exactly the way that I wanted. And as a result, I'm not going to pay. Or you made it, but the percentage of milk relative to syrup was not exactly what I had determined it should have been. And as a result, I'm not paying. That doesn't happen. We pay in advance for the latte. And then after we receive the latte, if we wanted to receive a refund, we might pursue a refund if the service was not exactly what we expected. But the latte is paid for in advance. This system of healthcare where you have very talented, hardworking individuals working on credit is not a tenable system. And certainly we're going to discuss that more moving forward and hopefully have some great dialogue and conversation. But the purpose of this season is really for you, the listener, to come to know not only my voice and my opinion, but the opinions and voices of a diverse group of healthcare providers, physicians who practice in different specialties and have had varying experiences during their careers. And this is really an opportunity for the healthcare provider to be not just an object of scorn and fear and anxiety, but a real person with a real history, a real care and concern for patients and patient care, and hopefully someone who could be trusted to care for you or your mother, your father, your brother, your sister. Because at the end of the day, we are a community that is comprised of individuals. And most individuals who take the Hippocratic Oath believe that they should first do no harm. So from the academic halls of the road to medicine to the white coat ceremony and the change in what it means to wear that coat to the rant about insurance companies, payers, and how they are beginning to manipulate the system to decrease the quality of care that patients receive to the faces and the stories behind healthcare providers in the practice of medicine. That's where we're going here with UpMed, the Journal of Healthcare's Race to the Bottom. We look forward to joining you with our next episode where we will talk with a physician other than myself who has done great things and will truly inspire all of us to do better, learn more, and be well.
Thank you for listening to this episode of UpMed. For more information on Dr. Erica, visit her website at upmed.us and her LinkedIn profile at Erica Rowe Urquhart. To continue the conversation, visit and subscribe to our YouTube channel at Rowe Urquhart. And don't forget to hit the follow button on your favorite listening platform so you never miss an episode. We look forward to joining you next time on UpMed, a Journal of Healthcare's Race to the Bottom.